but I've immersed myself in this particular initiative that we have, and I really see such a great potential for us to create some much needed change. I'll start with just to give you guys a brief overview of this session. I'll start with a very quick presentation to kind of give you guys an overview of the campaign that we are pushing for. And then we'll move on to a panel discussion of some of the people who have been involved in that campaign, mainly community leaders who have worked at the grassroots level to try to tackle this particular problem and have been involved in our campaign to come up with a solution that we can propose and fight for. So I'll go ahead and get started with this presentation. I wanted to get started with a small analogy, if you want to call it, and that is an analogy to how currently the CDC handles certain diseases and exposures. So for example, a tomato gets more attention from public health officials than communities by toxic chemicals. A tomato that has been poisoned or contains some sort of disease. So only 2 people need to get a foodborne illness in order to trigger an entire team at the FDA to track down and recall the food. And it is a very exhaustive process. Similarly, only 2 people need to have an infectious disease in order to trigger an entire team at the CDC to then track it down and isolate those infected. And again, this is a very comprehensive and step-by-step response that is very well outlined at the federal level. However, when communities are exposed to chemicals in their environment, there really is no coordinated government response. It is really a patchwork of responses at both the local level and the federal level that oftentimes are very much disconnected. And so this means that the government's unequal response to toxic chemical exposure leads to an unequal protection of the community's health. And most often than not, low-income communities are the ones that suffer the most. So these are some of the problems that I can outline, about the current system. So oftentimes people complain and are ignored until they no longer can be. At the local and state level, government agencies do various studies. None are coordinated, and often the agencies don't even know what the others are doing. And that is because there is a lack of coordination, and different agencies test for different chemicals and test different sources and use different standards, both again at the local and at the federal level. There's very little communication between the two. And this most often means that any study that is done at either level cannot be compared with the others. And therefore, that data is really not useful. So most testing is done to determine the extent of contamination in the environment. That is currently as it is done. But health risks are assessed based on data defining the extent of the environmental contamination, not on the extent of the exposure itself. That is rarely a feature of how, at least at the federal level, a health study is conducted. Therefore, new data, which is important to public health risk, is rarely collected. And so the agencies such as ATSDR, which is responsible to perform these health studies and identify the public health risk, uses data that may not even be applicable to the health study that they're trying to run. So once an investigation is initiated, there are no protocols to define how to investigate the chemical contamination. Now, the CDC has guidance on how to investigate a cancer cluster, for example, but there is no guidance on how to investigate a situation where chemicals have been identified and they may be poisoning the community. These are a few of the stories of the experiences that we at CHJ have come across. For example, in Pennsylvania, in Eastwood, a landfill that closed in the mid-70s became a Superfund site in 2001. So there, right again, there's 30 years of inaction right there. And no, from that point on, from 2001, no meaningful action was taken until 2011. And only partial cleanup began in 2017. So there you can see such a huge amount of time for this contamination to be around, poisoning that environment, that community, and nothing being done. Similarly, at Tar Creek in Oklahoma, ATSDR produced a study that had several findings, including the fact that a third of the children in that particular community were found to have high levels, elevated levels of lead in their blood. Yet the conclusions and recommendations that ATSDR produced from that study were completely watered down, and no action came because of them. And in Asheville, North Carolina, TCE contamination caused by CTS of Asheville was ignored by EPA for years, several years, until organized residents forced remediation in 2016. Without their action, nothing would have been done by EPA. So all of this problem brings us to what the solution can be. And us at CHEJ, we brought together community leaders from across the country to design a response program to investigate health problems in communities that have been exposed to toxic chemicals. Now, this response, this federal government response must have a few key components. It must be clear and defined, and it must be led directly by the community's knowledge, concerns, and questions. In addition, the response must have a defined timeline, and it cannot drag on for years. So it must have some sort of checkpoints along the line. And the response must use relevant health exposure data to inform the design of the health study. So data must be collected to answer the question, not try to be shoehorned into a study when it may not even be applicable, as I've said. Now, the solution that we've been working on may or may not end up being a federal response. That is still being worked on, but it must have all of these 4 components in order to be to have a chance at being successful. And so we are building support for this program, and we need your help in doing so we can get the federal government or whatever entity ends up sponsoring this particular response to implement and start protecting people's health. Now, with that, I will transition over to our panel discussion of some of the people who have been actively involved in this campaign and actively involved in informing it into creating an efficient and implementable solution. So among my 3 panel members here, I have Dr. Yomi Noibi, who is the Executive Director of the Environmental Community Action. I also have Hilton Kelly, who is the Executive Director of Community Empower and Development Association. And I also have Theresa Mills. She is the Small Grants Coordinator for CHJ, and she's also part of the Buckeye Environmental Network. I will stop sharing my screen here and pass on to this part of the session. Okay, I believe my screen is no longer being shared. And to begin our discussion, I would first like to ask all of our panelists to tell us a little bit about yourselves. Take a few minutes just to let us know who you are and what kind of work you are involved. Um, to get us started, I suppose I'll go in order. Dr. Noibi, would you mind going first, please? You are muted, sir. If you can unmute yourself. Excellent. Thank you.
Apology. My name is Yomi Noibi, and I'm a science environmental educator with a lifelong experience in advocating for equity, environmental justice. I started in academia, and my work in the community took me out of academia more than 25 years ago. For the past 25 years, I've been working in Georgia communities to provide training, organizing assistance so that they can have their own voice and demand for clean water, clean land, and clean air. So our role as an organization is to help communities come together to organize. It's about gaining power to address environmental health threats in an equitable way. And I'm committed to this, and I'm happy to be part of this process.
Great, thank you very much. Mr. Kelly, if you could please introduce yourself.
Yes, my name is Hilton Kelly, and I am the founder of the Community Empowerment Development Association located in Port Arthur, Texas, on the Gulf Coast. I started the environmental justice organization, which I just mentioned, 21 years ago, actually, in 2000. And one of the reasons why I started the organization, because my hometown, Port Arthur, Texas, was overburdened with a disproportionate amount of pollution and industries which emit that pollution and ground level ozone. In Port Arthur, Texas, we have a large number of refineries, chemical plants, and chemical incineration facilities, such as we have the Motiva Oil Refinery, which produced 633,000 barrels of oil per day. Right next to the Motiva Oil Refinery, we have the Valero Oil Refinery. Right next to the Valero Oil Refinery, we have Chevron Chemical. And a few blocks away from Chevron Chemical, we have Oxbow Calcining Petroleum Coke Facility. Now, that's just in the historic African-American community on the east side of town, where during the Jim Crow era we were forced to live. One of the reasons why I embarked upon this fight, because prior to coming back to Port Arthur from the San Francisco Bay Area, I decided that something needed to be done in my hometown. And I had devised a plan to give to someone, but yet when I came here to visit, I realized this fight was not an overnight fight because of the large amount of industries that are in the African-American community. So by May of 2000, I moved back here to the city of Port Arthur after being gone for 21 years. I served in the United States Navy aboard the USS Roanoke. I was discharged, honorable discharge, after 6 years of service. And I wanted to come home to make a difference. And what I found was that a large number of people in my city were suffering with cancer, respiratory issues. Many of them died from cancer and are at this present time still suffering and dealing with cancer-related issues. So we knew that the Environmental Protection Agency was not doing a good job at protecting people, and we had the number of deaths in our city to prove that. So I'm still embarked upon that work, and we still have a lot of work to do, and particularly when it comes to getting our environmental protection agencies and the state agencies to do their job.
Thank you very much, Mr. Kelly. And finally, we'll have Theresa Mills. Please, Theresa, if you could introduce yourself.
Yes, my name is Theresa Mills. I am in a suburb of Columbus, Ohio, the capital of the state of Ohio. 30 years ago, I was faced with fighting a trash incinerator that was found to be the largest releaser of dioxin in the country. We petitioned HSDR to come in and do a health study. They did come in rather rapidly, but we had a lot of congressional support behind us. Our Senator John Glenn and Senator Howard Metzenbaum were on our side. So that was the start of my activism. I contacted CHEJ 30 years ago. I've been with CHEJ since then. I've been employed by CHEJ for 10 years as a community organizer and small grants manager. So thank you for having me on the panel. And I do apologize for my glasses, but I'm having trouble with my eyes. So bear with me.
Not a problem, Theresa, not a problem. Thank you for that. So as you can see, we have three people with firsthand experience with grassroots communities who have been affected by some sort of toxic exposure. And so I will go ahead and ask you guys, and I don't want to stifle any kind of conversation. I really want this to be a fluid back and forth panel. But I would ask this particular question, and I believe all of you guys would have experience, but I would like to know your personal experience with any federal agencies responsible for health investigations or cleanup activities due to toxic exposures. And specifically, did you find them adequate? And if not, why? I'd love for you guys to elaborate a little bit on that. I don't know who wants to go first.
I'll go ahead and jump in on that one. For years, I have basically advocated the fact that when it comes to the Environmental Protection Agency as a whole, the regional offices to the federal offices, what we find is that the kind of protection that you get from that particular agency is contingent upon what party is in office. And what I mean by that, I find that most of the time when you have a Democratic Party constituency as president or in the White House, it seems as if we get a better response from the Environmental Protection Agency rather than if you have a Republican. But what we find is that a large number of Republicans that are put in office basically are put in office by energy companies, such as the refineries. They back a lot of your politicians. They have a lot of strong lobbyists. And I know a lot of the senators from the state of Texas, basically when they campaign, they're heavily backed by oil and gas industries. And many times, just like under the Trump administration, for instance, I spoke at the NEPA hearing in 2020, February. And Trump was doing everything he could possibly do to eliminate public voice from the comment periods when it came to making decisions on where oil and gas could build industries. Also, when it came to them getting their permits to operate in key communities, the Trump administration was fighting diligently to eliminate the NEPA laws, which basically stated that the public comment period was a very, very important component to helping to protect human health. Also, the Trump administration was trying to overturn the startup shutdown malfunction rule. Now, what is startup and shutdown? When it comes to refineries and chemical plants, many times when they're processing crude oil, the units, they have to shut them down periodically to do maintenance and whatnot. But it's almost like when you shut it down, they belch, they spew out tons amount of untreated chemicals. It's not filtered at all. And they just release stuff like benzene, which is a known carcinogen, sulfur dioxide, carbon monoxide. And it's almost like trying to start up an old car. But imagine this car, imagine there being thousands of cars being started up at the same time. And that's what it's like whenever you try to start up an old unit. And so the Trump administration was trying to get rid of a law that would not count those emissions that are produced by those industries during startup and shutdown. And in 2014, under the Barack Obama administration, we were able to get put in law the startup shutdown malfunction rule, which actually gave us the ability, or gave the EPA the ability to count those emissions. Because whether it's a natural event that takes place, which dumps tons of carcinogens into the air, or it's a man-made event, it still has a negative impact, and those emissions should be counted. So this is some of the problems that we're having. I think that our politicians play politics with the Environmental Protection Agency. I believe that agency should be a non-partisan agency.
Yeah, absolutely. Thanks for that insight, Hilton. It is true that there seems to be a cyclical almost response from EPA, depending on who is in the White House, like you said, or what party controls the Senate. And a lot of it, as you pointed out, has definitely got to do with the source, with the funding and the lobbying that's being done at the congressional level to get certain perks for industry. Now, I also myself, I'd have to say that in terms of my experience with federal agencies that are in charge of health investigations or cleanup, I worked for CHEJ previously as an intern and then as a fellow. This was probably 10 years ago, and during that time, I was able to work with certain communities, and one specifically that I actually mentioned in my presentation, Eastwood, Pennsylvania, where the small community organization over there was trying to have an input as to how the EPA would proceed to clean up a landfill that was closed over there. And just kind of to skip over the details, the EPA was actually trying to implement an innovative cap, a new cap to kind of prevent water and leachate from coming out of that landfill. Now, that particular type of cap was only being used, at the time at least, out in the West Coast, where the temperature and the weather really is much more arid than it is out here in the East. And so it works over there because of the fact that there is not much rainfall in places like Arizona, for example. And so trying to implement it over here, there were several experts who were questioning that particular type of landfill cover. And the truth of the matter was that EPA was trying to implement it because it cost a fraction of what a conventional cap would have cost. So that's an example that I saw firsthand of how a federal agency attempted to cut costs at the expense of a community's health, really. So I don't know, any of my two other panelists have any personal experience with federal agencies and found them either adequate or inadequate? Oh, Dr. Yomi, you're muted.
Let me just build out on what Jose said, and Hilton. Three things in your presentation, Jose. One thing is common in the three examples you gave, that it takes a lot of time before they respond. Time is a factor, and we cannot keep waiting. People die. And the second thing, is that, Hilton said, who's in the White House matters. That is true. But my lived experience in working with communities over more than 25 plus years is that underneath that is that when the community organize, whether it's Republican, most of the environmental laws that we got today, we got it under a Republican president, Nixon. Why? Because at that time, the climate to organize and get things done was very high. So we get a democratic leader, but we still have to stay on organizing in order to get what we want from ATSDR or EPA. Now, with regard to my own personal experience, I have quite a few. but it's summed up in what you just said, time. And then the question, is it adequate? Well, your experience is that it's adequate in ensuring that the regulatory agencies control the expected outcome of the process, meaning, you know, they go there with an intention and they get what they want. So the process of bringing us together is a mockery. So that process, you know, yeah, they get what they want. Adequacy, yeah, this is what we're going to say will happen. So that is what I have seen. And, you know, for also be careful of what you ask for when you ask ATS there to come and help you. In Gainesville, Georgia, we had companies surrounding an African-American community that a group called the Newtown's Florida Club, a group of women trying to help because people were dying. And so they petitioned ATS there, but it took them a while to come. And finally, when they came, what did they find out? The exposure, what did they call it? The throat cancer and the respiratory conditions are not due to any exposure from the nearby companies, but due to what? To lifestyle, your drinking and your smoking. That was their conclusion. So when we invite them, we have to take charge of how things are designed. If we can inform and guide the design process, it's not going to be in the best interest of the community. That's what I've learned the hard way. So I'm very careful in trying to petition them. You know, so we have to be careful, and that is why what we are doing with this campaign on equal response, on equal campaign, on equal response, on equal protection is the bridge for getting equitable protection for all, not just a group of us, but everybody, including the underserved, low-income people of color who are overburdened with toxic exposure in their communities.
But I think it's also important to remember is that many of these industries, as we know, by law, they have the ability to dump toxic chemicals into our air and in the water, and in some cases, inject it under the ground. So it's critically important that we try to raise the bar when it comes to the Environmental Protection Agency passing various laws that they pass, which allow these guys to do business and dump certain chemicals and certain amounts of chemicals. So the only way I believe that we're really going to have a lasting change is to continue to work to change policy and laws and regulations. That's the only way it's really going to change. But it seems that every time we get a change of administration, the laws can be either more stringent or weaker, or most of the time they just pull the Environmental Protection Agency a budget and they don't have the ability to go out and do enforcement actions. But I think the key component to really putting an end to all of this is basically getting rid of some of those bad laws and regulations that are in place that allow these guys to dump or inject underground or in water.
Absolutely. Absolutely. And just to echo on what both of you guys really said, in terms of the budget, for example, that you mentioned, Mr. Kelly, on the for the EPA, I myself, literally a year back, I was a contractor for the EPA, working within their safety and sustainability division, and I could see firsthand during that time, and this was during the Trump administration, that the agency itself had severe or significant, I should say, and several budget cuts to almost every program that was implemented in the previous administration during Obama. And so we can see, I was able to see firsthand exactly what you're talking about, where you have people there who, by all means, may have good intentions, but they don't have the means to be able to do it because of those budget cuts, because of certain regulations being rolled back. And to echo also what Dr. Noibi said, one of the pillars of our campaign is just what you mentioned, that the community and their concerns and their questions must be the cornerstone. They must lead the health study or any kind of response, really, that would be created in their community. Without their participation, without their input, any agency can come in and, like you said, right, be ready, be come in with a predisposition, really, to come in, not find anything, and then really not find anything, right?
But I think that's why the Biden administration, what he has done is basically changed the game with the Green New Deal. With the Green New Deal, when you go after a federal grant when it comes to clean up for environmental justice, what they're doing now is putting the grassroots people in charge. They have to be funded. They have to lead the charge within that particular mandate. And you have to partner with a real grassroots leader who is fighting that particular environmental justice fight. So I think that's brilliant of the Kamala Biden administration to rethink how money is distributed to fight for environmental justice and resiliency when it comes to flooding and hurricanes.
Yeah, I totally agree with you, Elton. So that is all the more reason, folks, that we have to maximize the opportunity we have to advance equitable protection. You know, that is the bottom line: equitable response, equitable protection in regard to toxic exposure. And that is for real. This is a good time to advance it. And that's part of the communication we're trying to have here. You know, I like to acknowledge, this is not, you know, I didn't tell you I'm from Atlanta. What I also want to acknowledge is one of my colleagues on the screen. I didn't know, Professor Shafi. Thank you for joining us. I work with of Spelman College. Thank you, Prof.
I agree with what they're saying about the Biden administration. My one concern there is that it's not in law right now. It's not been codified into law. And until that happens, then the next administration can just totally go and wipe it out. I know they can wipe it out even if it is codified, but one of the problems that we saw in Ohio and around the country, especially in Ohio, I was involved with 12 ATSDR studies. And what we saw was, because ATSDR partnered or had like a memorandum of understanding with our state health department, the state health department took over basically took over the investigation. Well, we had been working with the state health department and we were getting nowhere. That's why we petitioned ATSDR, and then ATSDR turned around and went back to work with them. So they tried to, many times, push us out of the way, and we would not let them do that. But when we finally got to the point where they said that it would have to do biological monitoring, they did soil samples and they were going to do biological monitoring. So we always wanted to know, okay, what's your protocol for biological monitoring? We asked for that. They would not, they refused to give that to us. They would not give us their protocol. So we had to actually go to Senator John Glenn, and John Glenn got the protocol for us. Well, when it came out, remember, this was the largest releaser of dioxin in the country. This was this environmental justice community, both minority and low income, of course. And what we found out was they eliminated anyone under 18 and anyone over 65. So they eliminated the most susceptible population. So, you know, that was just ridiculous. So we sent them back to Atlanta, you know, with their tail between their legs, and, you know, did not want them to do the study. So, and I mean, they kept, the other communities that I worked in, they came up with the conclusion that, yeah, you have, you know, high rates of cancer, but we can't prove where it came from. And then nothing happened. So what was the point in HSDR even coming in We already knew we had high rates of cancer. We didn't need the agency to tell us that. What we needed was a response. Like one community had high breast cancer rates. This was the WTI hazardous waste incinerator. They had high breast cancer rates, high rates of major organ cancer. Well, with breast cancer, what happened? That's what we said. Well, what's next? What are you going to do to try to prevent some of these cancers? Did you bring in the mobile, breast, screening unit? No. So it was pointless, absolutely pointless to bring in any of the health agencies. And that's what we need, a health agency that will make sense, that will be honest, be truthful, tell us what we don't want to hear. We may need to hear it. Tell us what we don't want to hear. So.
And it seems like you're also mentioning, Theresa, that there needs to be an action component from that response, correct? Yes. And that, they can come in and tell you, like you said, right, there are elevated levels of cancer here or of this particular disease, right? And it may or may not be related to the exposure that you have, but what can they do about it, right?
Yeah.
How
I remember standing up at a community meeting when they said that, and I stood up and I said, well, thank you, Captain Obvious. It was obvious of we have high rates of cancer. Thank you, Captain Obvious. What are you going to do about it? Yeah. Nothing. They said they had no authority to do anything about it. So,
yeah.
So perhaps that is yet another thing that we can, or another pillar even that we can consider adding to our response, that there needs to be an action component to address the health, the health outcomes of any given community. Now, like you said, oftentimes that is pushed out to the local authorities, right? Either the local health department or something like that. But again, there needs to be, I believe, a defined connection, and perhaps even even something like a threshold level of action, where you see a cancer above any given above the state average or something like that, right? Where we can see an action component.
Jose, can I?
Yes.
Theresa talk about proof, and they should communicate the truth. About proof, that's a big one. And the system is set up in a way that they have to prove. And that is a challenge for the underserved communities. And we are asking and pushing back that we need to shift the burden of proof to the corporate polluter. So that is a challenge. So that premise itself is not in the best interest of the community that we need to change. Yeah, we need credible evidence. We need evidence, but sometimes we may not be able to establish cause and effect relationship, but we still need to take some actions. So my question to myself and to the agencies, while you are trying to do this study, what intervention strategies can you suggest to us to reduce and prevent harm? We need that based on credible evidence. You are in a position to tell us that, and we need to know that.
Well, that's true. The one concern, I was involved in Birmingham, Alabama, and the agencies actually came out. They said that there was high rates of, or high lead and arsenic in the soil and around people's homes. So their intervention was to tell parents to make sure their children took their shoes off, not to bring their shoes inside, and to strip their clothes, and to make sure you didn't eat any of your vegetables out of your garden. And so that, it's putting the burden on the community. It's like your fault because you allowed your children to come inside with their shoes. My God, who would do that?
Absolutely. And the other thing is that, if you're trying to, as the agencies do, if you're trying to establish that cause and effect, right, You're trying to use risk assessment to prove, really, right, that a given polluter, beyond the shadow of a doubt, is responsible for the health outcomes in the community. It's a long shot. It's such a long shot. As someone who has studied risk assessment, it is so difficult to prove that association beyond the shadow of a doubt, that the vast majority of studies that try to use risk assessment in order to connect a given polluter or exposure to a health outcome will tell you it's inconclusive, and it's just not designed to be able to find something.
Yep.
So
I
yeah,
think,
absolutely.
I think it's important that we not forget that our local governments should play a key role in protecting its citizens in the towns where those industries pollute. Let's take Port Arthur, for instance. Port Arthur is home to at least 6 major oil refineries, about 6 chemical plants, chemical incineration facilities. Veolia Chemical Incineration Facility, for instance, is a French-owned multinational chemical incineration facility. They are all over the world, and they have a huge one here in Port Arthur as well. These guys petition for waste, chemical waste from all over the world to bring to Port Arthur to burn, on top of the insult with all of the refineries and chemical plants we have here. Now, many of these guys sit in unincorporated areas, but yet at the same time, local government has to allow and permit them to do certain things. But if we somehow can garner the support of local government, despite what the federal government says they can and cannot do, I believe we could have more leverage in getting them to adhere to the Clean Air Act laws and regulations that are on the book. But many times the local government flies under the radar because we're busy looking at the big EPA or the regional EPA, but we need to look at those state agencies and push them to do the right thing, and local governments. I think they can do a lot better job, a lot quicker, even than EPA, if they got involved. Because many times you find that your local governments also don't want to get too involved because they're looking at their tax base. They're looking at how much money these guys give back. But if you look at most African-American communities or people of color communities where these industries are housed, most of those communities are dilapidated, falling apart, and most of the people don't even work there. So we have a lot of work to do on a local level when it comes to push as well, not just the EPA.
That is true. That is true. So,
well, in our situation, the Ohio EPA did a risk assessment, and they said, oh, it's under 1 in a million, because we had no farms or anything like that. So we had a fundraiser, and we hired a plane to go up and take pictures of all the farms in the area. We presented that to the US EPA Region 5. Region 5 turned around and did a risk assessment, and it came out to almost 300 in a million. So our local health department was absolutely worthless. Our state and our local health department was absolutely worthless. I would never, as I said in with one community, figures don't lie, but liars figure. And that's what we felt that the agencies were. They were not telling us the truth. Just tell us the truth, whether we want it or not, tell us the truth. And we weren't asking, yes, we did kind of pinpoint one industry, but we weren't trying to pinpoint that industry because of we wanted something from that industry. We were concerned about the health. I mean, I had a manila envelope delivered to my front porch. I had no idea who it was from. And there was a study done by Ohio State University on placenta. And the placenta, the dioxin had crossed the placenta. So we had the babies born pre-exposed, pre-poisoned. But it was hidden from us until some brave soul delivered it to my front porch. So I don't trust my local. I don't trust them. That's why we went to HSR. Well, that wasn't a good idea either. So
Yeah. So just to move a little along, we have about 20 minutes left in the session. And I want to leave some time at the end for some questions from the audience. So I just wanted to ask one last question to our panelists before we move on to the questions. And that is, so in your view and in your involvement with CHJ's Unequal Response campaign, what makes this particular effort different than anything before that attempts to fix this broken system? Any of our panelists can choose to go first.
Well, I think that, you know, because of your leadership there, that have built CHEJ, they've been on the ground. They understand the issues that many of us are dealing with. They have great connections with policy makers as well. And they're well organized. I think their message resonates with people on the ground, such as myself, because of their tenure in the environmental justice fight, and they really get it. So, you know, CHJ leadership don't just listen, they act and they support. And this is one of the things that we definitely need in vulnerable communities.
I ditto that. I will add that the approach taken to address this problem is trying to look at it from the root. We are the people be on the burden. Give us a voice to drive the process. So CHJ is not looking at it just from one angle, they're looking at it from a system approach. If you look at the whole system, you bring about a change. And that is what this campaign is all about, looking at the whole system of responding and protecting people exposed to toxic chemicals. That is a big deal. When you look at it from that system point of view, you define the new process, and then you define measures. And at the top of that is to come up with a new policy or a new agency to make that happen. Right. So you don't want to stock new ideas in a new wine. You put new wine in the old bottle, it will not work. So CHJ have already seen that. So they are pushing, and we, Eco Action, have known CHJ before it became CHJ. Clearinghouse, and we get support from them. Right. So I believe that this is an opportunity. The idea that people are listening now, this is the time to push it, folks.
For sure, thank you. For my part, having been involved with the campaign for really only 2 months since I started with CHJ, I have absolutely immersed myself in all the aspects of it, whether it was the community leader meetings that came up with such valuable viewpoints from the people affected, and that also informed the possible solutions and that really came up with the 4 cornerstones that I mentioned in my presentation that an adequate response must have. So those that particular aspect to me was perhaps the difference maker in why this campaign has such momentum at the time and can build even more. And that's just because we are involving people who are in trouble, those who are in the fence line, right? Those people who are affected, and we're giving them that voice and asking them to tell us, what can we do to fix it? You tell us, what can we do? And then we'll push for it. So I think that is probably what sets us apart from other attempts, at least, to fix this particular problem. And so I'm really excited to be able to continue pushing that campaign that way. So before I turn over to do some questions from the audience, I don't know if any of you had any parting words or anything like that you wanted to add before we move to the questions.
Basically, I'm hopeful that CHEJ continue to do the work that you're doing and to support as many organizations as we can during this administration. Because as we know, with every change of the guard, when it comes to sitting presidents, opportunities come and opportunities go. And for a long time, we haven't seen this type of opportunity when it comes to the Green New Deal. So we need to hurry, work as quickly as possible, and take advantage of the opportunities that we have with the Biden administration.
Great. So I guess I'll go ahead and move on to taking questions from the audience. I see that we have a few here already, it seems. I'm gonna read through the chat. And if any other ones are coming in, I don't know, Vivek, if you can see the ones coming in through the app. I don't know if I can see those here on the chat, but if I cannot, could you send them my way, please?
Yeah, Michaela will send them over. I only have access to the Zoom. I don't want
Okay, no problem.
I'm
No
recording
problem.
this, so I can't exit the Zoom window, but
Great, thank you.
I'm over from Cuba.
Okay, so I have a question here from Frendel, and she asks, well, first she says, thank you everybody for sharing your wisdom and experience. Her question is, if ATSDR does not answer a petition, what are the recommended next steps? Perhaps you would be able to answer this question, Theresa.
Well, they're required by law to at least reply to the petition. How they reply, it may be such thing that, you know, they say they can't help. Then that's when I would take it up a step, you know, take it to your local, to your federal legislators, because they control the budget of the agency. And if you get in their face, they're more likely to at least respond to you.
Gotcha. And the way that you would contact ATSDR, I imagine, is just through email, or do they have a hotline? Do you know?
Well, no, they have, I think they have one online now, but I just, you know, wrote them a letter and I called it a petition. It was nothing. It was like 2 paragraphs. So and they were required by law to respond. And in my situation, yes, they did respond. Other situations, we had to push it, you know, and push and push and push and push. But, you know, just have to, as I always say, you know, I have the right to be in anyone's face I so choose. Yeah. And if I choose my federal representative or my federal legislator, then, you know, he better work on my behalf. And that's what I always say. As my elected official working on my behalf, you need to do this. So push them.
Great, gotcha. So the other question that we had was from Vivek as to how do we rebuild trust with the federal and state level agencies? Since we've had a good reason to distrust them in the past. And he cites examples like the COVID response, previous complaints to ATSDR, et cetera. So how do you work on rebuilding trust with federal and state agencies? I think that's a tough one.
Tell the truth.
I think that's easier said than done.
That is the truth. But however, as human beings, we all, you know, do wrong things and we forgive. But we have to have the focal point that in trying to build this relationship, EPD, ATSDR, we need to have indicators of when we say we're going to do X, we do it. By having indicators of action and we follow through, we build trust that way. When I say I will do A and I do it, I'm building trust. So those are ways in which we can intentionally build trust with the agencies, but we have to make them see this is that we are working towards that pathway, because they have their challenges. Some of us know them, but some of them are just where there are people in those agencies that are even better than some of us in the community because they really want to do the right thing. And when I say that, I really there are few. But we want most of them to be like that. That's why we have to keep pushing and keep, praying. I pray, that these people, I hope they see the light.
Yeah.
Seriously,
Right, absolutely.
I
And
think at the end of the day, though, it's about trust, but at the same time, when those people are in those agencies or they're in office, whether you trust them or not, that's all you have to work with at that given moment.
Yep.
So therefore, we have to put in our demands, put in our requests, what we need in our communities, and monitor them and hold their feet to the fire. We put you in office, we can take you out of office. Now, it may take time, but at the end of the day, it's, do we trust any of them, Democrat or Republican? Not that I don't think that matters much, because at this point they're in office, but we need to monitor their actions and just remember that, and remember that we need to remind them that we vote.
Yeah, I
Right.
agree, my brother, but most of the people we're dealing with are not elected officials. They are bureaucrats in the agency. They are permanent employees. So we have to look, your point, making them accountable, that is for real. And we have the power to do that. We just have to let them know we're still in charge, folks. Even though you are not elected, we can still make you accountable to us.
Trust but verify.
Yeah.
correct. I think part of it has to do with the approach that we outlined as well, that where any response has to follow a specific timeline, right? With checkpoints, with noted checkpoints that the agency or whatever entity that is doing the response, right, must follow, and that will both build trust, as we said, right, and allow us to hold them accountable. Because if they miss one of the checkpoints, if they miss one of the timeline structures, then we can then say, okay, this did not happen, but there has to be consequences, right? So I think that is one of the pillars of the campaign that we created, and it's integral in improving the system. We have one more question here, and it's from Richard Allen, and he asks, let me see, he says, how does a government bureaucrat justify putting more protection response on a tomato, a food item, than on toxic chemicals posing a great public health threat? That is the question, isn't it? I mean, how can a coordinated response, right, be there for a contaminated food, which it is a public health threat, and a coordinated response is definitely what should happen. But how can not an equivalent response be present for a public health threat, such as a chemical exposure or chemical contamination in a community? That beats me. I do not. Right. And so I think that's what we're trying to fix at this point, right? Where we can show the government that an exposure to a contaminated substance or a contaminated site is just as dangerous, right, as a bad tomato. And it's perhaps on our end harder to prove, like we were saying, right, that particular exposure or a particular industry is responsible for the health outcomes, but they're just as deadly, if not more so, right? And there seems to be one more question here. And yeah, so Vivek asks, this symposium, myself as a lead, developed an EJ scorecard for MD legislators and select agencies. Select agencies maybe replicate, fine-tune, and expand this to the federal agencies. Interesting. So a scorecard for Maryland legislators. So it'd be interesting to see if we could extend a similar kind of evaluation, right, to the federal level. Now, how really do we do this? I'm not sure, but it'd be interesting to see. Do you guys think that something like that, like a scorecard, would have effect at trying to hold agencies, federal agencies, accountable?
Well, I think if it has some teeth to it, some merit to it, and some strength, and those agencies understand the power of that scorecard and either scoring high or low, but it has to have some teeth.
That's very true. That's very
And
true.
it has to have a plan. You know, we take a survey or a study or something like that, but what happens afterward? You know, what happens with the responses? So they're always, Lois and I are really big on plans. What's the plan? What's the plan? You know, an action plan. You got to have a plan. What's the next step? Think 5 steps out. So
Right. So, I mean, I do think that perhaps if this is something that is being implemented in Maryland, it would help to, keep track of it and see how that particular system works, right? Does it actually work at holding legislators accountable? And
what's the issue that they have the survey on?
so I think, I'm not sure. I guess Vivek would be able to tell us more, but it's an EJ scorecard, right? So it's on issues related to environmental justice. So I don't know if you want to expand, Vivek.
Yeah, I can just jump in really quickly. So we had a separate session yesterday in the afternoon, and it revealed the methodology behind our scoring. We looked at EJ related bills and how different state legislators voted on those bills, and they received a corresponding grade.
Okay.
And then we outlined the top 10 and bottom 10, or mostly the top 10, because we would be dealt with some backlash if we revealed the bottom 10. So we didn't really go that far, but that's definitely something I think in the future, if we have leverage and we have the resources to, we can, stand up to those particular legislators. So there's a recording of that will be released, and their final report will be released sometime in September for those of you who are looking forward to that and attended that session.
Yeah. I think that would be a really good idea once we get a little bit farther into the process and figure out where we're going, exactly going to go. Because I think that could help us find the champions that we're going to need in the legislature.
Definitely. We want to pinpoint our allies, right? That's
yes.
strategic.
Yeah.
I agree. Thank you.
Yeah,
I
absolutely.
think it'd be a great tool to where you could do comparisons. Like you said, we can find our champions, but yeah, I think it'd be a great tool in that regard.
Could also find our enemies, for lack of a better word. I don't want to call anyone an enemy out here, but
yeah, absolutely.
At least internally, we don't have to release that, but we can identify who. Yep.
Right.
For sure. And thank you for bringing that up, Vivek. I will follow up with you to sort of see how that moves along. And depending on how easy it is to implement and whatnot, I would definitely love to collaborate with you and whoever else was able to come up with this system to see if maybe we can expand it to the federal level.
Awesome. Yeah. And sorry for hogging the Q&A. I'll let the others jump in now, but
not a problem. I think we have probably a minute left. I don't know if anybody else has any questions. I will leave that last minute to you guys.
Well, I want to thank everyone for listening. I also want to encourage and invite you to join this campaign, because this is a campaign moving forward, and we need you. And we need you to self-educate yourself more about these issues and share with others in your community so that they can be part of this. If you're from Georgia, please call Yomi. We'll be able to work together.
And I would like to leave with saying, wherever you're at in the country or in the world, if you see an environmental injustice, simply because no one has spoken on it doesn't mean it's not an issue. So therefore, if you see something wrong, step up and say something.
Right. And I will leave with the comment that Lois and I always make is, and I have to say this because I can be rude and obnoxious sometimes with elected officials, that polite people get poisoned.
Yeah. So I'm going to close the session off then, and thank you all of our panelists and all of our audience as well for being here. And like everybody said, I would encourage you to connect with us. We would be glad to, expand our campaign to include everybody. We'd need as much people, as much allies as we can get to get this thing moving forward. I will send Vivek my contact information, and so we can connect that way. But again, thank you very much for being here, and we'll be in touch. Thank you all again.
Thank you. Take care.
Thank you.
Everybody at
Thank
1
you.
p.m. in their respective sessions. Thank you, everyone.
Great. Thank you very much. Bye, everyone.
Bye.